The Health Plan Hacker. Thank you for joining me today, and welcome to the first installment of this channel. Hopefully we're going to get you started down the right path to lower health insurance premiums. I've actually done a couple of these videos, and I went into some great detail explaining how insurance companies make money and how they basically set up employers and employees to fail so that the claims are higher than they have to be, all in an attempt to get the premiums up as fast as they possibly can. And what I've noticed over the years now is that employers are spending thousands and thousands of dollars per employee a year, and most of those owners, business owners, don't even understand how the insurance works. The entire benefit market has really become stagnant because it has grown increasingly complicated. There's fewer people that understand it, and so they willingly take the increases that are offered up by the insurance companies. Our goal is to educate the owners and employees about health insurance plans so they can make good plan design decisions and reduce the premiums. It can be done. We hear from people frequently on how health insurance companies are mistreating them and purposely inflating the cost of insurance. Now remember this. This is absolutely correct. Health insurance companies are for profit. They hire very smart people whose sole purpose is to get employers and employees to spend as much money as they possibly can on healthcare. Unfortunately, the hard cold truth is that the public allowed this to happen because before the 90s, most health insurance companies were not-for-profit or mutual companies. That all changed whenever these nonprofits figured out that it would be more profitable if they could become for-profit. So they began selling off, cutting deals with legislators and selling off the nonprofits to convert the assets over. So let's get started with the beginning with some basics. And today, the first term I'd like to review with you is BUCA. Now, our industry is just littered with acronyms. There are so many of them, it's hard to keep them straight. But this one's pretty consistent and has been around for a while. And what it means is Blue Cross, United Healthcare, Cigna, and Aetna. And generally speaking, it's used whenever somebody's talking about the entire industry. Because between those four carriers, they probably write somewhere around 95% of all the business in the country. So let's start with taking a look at some of their Twitter pages. And I want to show you some of the marketing that goes on, even though you don't realize it. And if you look at first I want to clarify something, that Blue Cross is really kind of a misnomer. The only thing really remains of Blue Cross is Blue Cross and Blue Shield Association. And this is the association that those former Blue members have to belong to in order to take advantage of the nationwide network. And you can see here that, let's just take a real quick look. You can look as I scroll down, you can see all the things that they're advertising, asking you to take care of yourself and get your shots and all of those things. So they really are not an insurance company. This is a entity that exists for all of those former Blue Cross and Blue Shield companies. But if you do a search for Blue Cross and Blue Shield, what you run across is all the names of the different Blue Crosses around the country. Now, many of these are going to be aggregated, like Anthem Blue Cross includes several different plans, like Blue Cross of California and Blue Cross of Missouri and Blue Cross of Indiana are all Anthem Blue Crosses. There's also Health Plan Care Services, which is Blue Cross of Illinois and Blue Cross of Texas. They do retain the Blue Cross name, but if you look at their books, that it's just the name. It all goes to the for-profit organization. There do remain a few independent, nonprofit Blue Cross plans. Blue Cross of Kansas City happens to be one of them. Unfortunately, they just don't have the power to really help control the markets, all of the aggregated or conglomerate Blue Cross plans do. And of course, U is for United Healthcare, And if you look here, you can see they've got about 55,000 followers. So they use these tweets to help remind you to go and get the care that they want you to get. They're the ones that want you to get the preventive care. And there's a good reason, but it's not what you think. You're thinking they're being altruistic, and they're not. They want you to get their care so that they can get you on a treatment protocol. And let me give you a real good example, and this is something I'll go into in the future. But do you know that if you are a certain age male, you're supposed to go and get a colonoscopy? Did you know there's an alternative? Did you know that it is literally a postcard that you mail in, and the test costs about $60, and it will tell you the same information that a colonoscopy will tell you, except the colonoscopy is $3,000. So keep that in mind. They want you to have claims, so they are not going to be as forthcoming about some of these options you have available to you. That's where we come in, and that's what this channel is going to do for you. And then we have Cigna, and you can see they have about 50,000 followers. And again, it's talking about them and the great things they do, and what you should be doing in order to try and take care of yourself. And Aetna, of course, is a similar Twitter page. The only thing of note here is that Aetna actually is owned by CVS, and CVS bought them to maintain control of the prescription trade that Aetna does, because that's how they make their money, obviously. So if you're with Aetna, you have to use a CVS pharmacy in order to get your medication. So again, keep that in mind. You know, what changed why would a pharmacy buy an insurance company if they were just paying claims? They don't. They're making money off the claims, the insurance company is, and so CVS did this as a defensive measure to make sure that they get their share of the prescription claims. That's a theme we're going to continue on with during each one of these videos over the coming months. One other organization that actually is an HMO, and I bring them up because I cite them frequently. They have a whole company that does nothing but aggregate data about plan designs, about premiums, about medications that are covered and medications that are not. It's a really good resource if you're looking for raw data in a usable, easy to read format. But one of the ways in which the pharmaceutical companies dip into your pockets that you don't know about is given by example here. Kaiser's telling us about the FDA approval for a new medication for Alzheimer's, which is fabulous. I mean, I hope it works. I hope everybody who has the disease can get access to it. Keep in mind that $56,000 a year is a pretty steep figure, but it's funny money. And they set it up at $56,000 a year because they don't care about the private insurance companies. They'll cut a deal with them. What they want is access to the Medicare and Medicaid markets. Now, the difference is that the Medicaid and Medicare markets are run by the states. And so the states generally have to pay for those claims. So basically, the pharmaceutical companies have managed to dip into the taxpayer's pocket. And this happens frequently with many different treatments. It wasn't too long ago that hepatitis drug came out. It was curable at $78,000 a year. And you don't think about it, but everybody who's on Medicaid or state care, which includes prisoners and those who cannot afford to pay for their care, end up getting eligible for these medications at no out-of-pocket of their own. Another source of the increased premiums that is just constant is all the non-for-profits who are trying to get some type of care covered, or they are trying to get socialized medicine. You can see a few of them here. We got the Michael J. Fox Foundation, and he has a specific need that he's trying to get covered. You have the Susan G. Komen. Of course, she's they're lobbying for cancer treatments, and I'm sure they're paying for some of those things for the public, some of the public. But all of these organizations are either asking for socialized care or to get some form of care covered by the federal government, or to mandate that the insurance companies cover it. One that I'm particularly familiar with and like to go into a little more detail is a direct result of the buyout of Blue Cross and Blue Shield of Missouri. Back in the late 2000 or late 1900s, after the deal, or as part of the deal for the Blue Cross and Blue Shield to sell itself to Anthem, which was actually WellPoint at the time. That's another story. But they had to divest themselves of all of the assets of the company. And since Blue Cross and Blue Shield of Missouri was a non-for-profit, all of the assets belonged to the people. And they were supposed to use those assets to help fund and pay for care or promote care in Missouri. So the judge allowed them to sell the assets to Anthem, but they had to set $1 billion aside to establish a foundation so that foundation can take over the charity of Blue Cross and Blue Shield. Unfortunately, whenever these charities are set up, they are typically founded and staffed by very left-leaning people who want to see socialist care or want everything to be covered. And typically they want it to be covered by government. Sometimes they do also, this organization does also provide some nonprofit type facility, like buying ambulances for poor counties and things of that nature. But they heavily rely on a bunch of other nonprofits like Planned Parenthood and organizations like that who actively lobby legislators to try and change the laws. And so it's a constant onslaught from organizations like this that are approaching your legislators to get them to cover something that ultimately is going to have to be paid for by a tax increase. So I hope you keep that in mind, because whenever they force something onto the insurance companies, that means that your premiums have to go up. And speaking of which, I'd like to show you just exactly what happened over the past 10 to 11 years with the passage of Obamacare. And so if you look at this blue line, this represents the increases in deductibles that have happened amongst all plans. Now, you can think that that's just a plan change, but really what that is a premium increase. And this red line represents actual premium increase for family premiums. So the premium increase has gone up 55%, and the off-book premium increase in the form of deductible increases has gone up by 111. So what really happened was that the premiums went up probably about 75% just since 2010. And the problem with this is that as employers look to offset the premium increases by imposing more of a burden on its employees don't go to get care. They end up going to the ER and getting the most expensive type of care, and the problem becomes harder to solve for physicians and hospitals. So it really is not a good way to keep the cost down, because you ultimately end up paying it in higher out-of-pockets when you get and then you get the increase as well. So I've got a couple hacks for you all today, and then I got one for the employer and one for the employee. For the employer, I'm going to suggest that you take a look at your census of participating employees, and if anyone is 65 years or older, you could offer them an option to take Medicare, and you can then offer to pay for the Medicare supplement either through a Section 125 or a Section 105 plan. And I would highly encourage you to do that for a couple reasons. Number one, it reduces the premium significantly for you. And number two, it improves the benefit plan for the employee, because for the most part, if they will have no out-of-pocket for health care and maybe a little about out-of-pocket for any medications if they happen to be taking some. So something to investigate. And then for the employees, most states have some kind of law that that states that doctors cannot charge anyone more than what the state pays for Medicare or Medicaid procedures. So what that means is that if you are a senior citizen, you're on Medicare, and you go into the doctor to get a cast, and the cast costs $100 because that's what Medicare pays. If that doctor accepts Medicare, he has to accept that $100 is payment in full. And the doctor's office is not supposed to discriminate against patients by charging some patients more than others. So if you find yourself with one of these high deductible health plans, and you know you're going to have to pay for the claim out of pocket, ask the doctor's office what it costs, what they get for reimbursement from Medicare for that particular procedure. When you do that, then tell them that you would like to pay them cash for that procedure, the amount that they got paid from Medicare, and ask them if they will accept that. And tell them that you would not run it through. You would not run it through your insurance company. And when you do that, you've gotten the lowest price you can possibly pay, and then you take that claim and you submit it to the insurance company via mail with a receipt for it. And the insurance company is going to have to accept it because it was a legitimate claim, and the physician's going to have to accept it because they are required by law to accept those to accept that as payment in full. Well, that's it for now. I'd also like to point you all to one more location if I can. This is Missouri General Insurance Agency's website. I am a consultant for them, but they are one of my sponsors, and I'd like you to go over there and give them a subscribe or a follow. They're just started their Twitter page, and they've only got 32 followers. It's a good company with a diverse amount of producers, and they can handle any of your needs for property and casualty or personal lines coverage. Their most recent tweet was a notice about a kitty recalling TrueSense smoke detector. So if you have one of those, you might want to check it and see if you're subject to that recall. Anyway, thank you for watching. If you found this information helpful, please leave a comment. I would love to hear from you. Hit the like button, alerts, and subscribe. And we'll see you soon.